In the previous videos, we have reported on the evolution of the COVID-19 situation in Japan. We concluded that the low number of infected people in Japan compared to Europe and the US may be due to the originally low number of infected people and the mental culture of Japanese people who do not want to bother others. However, it has been reported in Japan that Japan's quarantine measures against COVID-19 have not been a success. This is probably as a result of the fact that the infection exploded in August this year, with more than 20,000 people infected per day, which put a strain on the medical system and resulted in the deaths of people who were waiting at home waiting to be hospitalized, which was reported with great impact. There are two hidden facts here. The first is the definition of deaths by COVID-19. For example, according to the Ministry of Health, Labor, and Welfare, the number of deaths in Japan in 2019 were 1,381,093, while in 2020 were 1,372,648. We do not see any impact of excess deaths due to the number of deaths caused by COVID-19. This means that whatever the direct cause of death, if it is found post-mortem that the patient had COVID-19, it will be the cause of death for all. Another thing is the tightening of the medical system. During the end of August and September, the medical system would certainly have been under pressure. However, according to the current survey by the Ministry of Health, Labor, and Welfare, the national average occupancy rate of the hospital beds that were supposedly prepared for COVID-19 was about 62% on August 25th. The remaining 38% were not utilized. These beds are called ghost beds, meaning that there were beds that had been notified to the national and local governments as COVID-19 beds, but were not actually available. Although the data is a bit old, 2014, according to the Ministry of Economy, Trade, and Industry, Japan has 8,442 hospitals compared to 5,710 in the United States. The number of hospitals beds per 1,000 people in Japan is 12.3 compared to 6.3 in France and 2.8 in the US. In Japan, however, many hospitals are privately run, and many of them are hesitant to accept COVID-19 patients, resulting in a large number of ghost beds, which is thought to have put pressure on the healthcare system. In light of the above, the government's response to COVID-19 in 2021 was criticized, resulting in the Suga administration's transition to the Kishida administration. The Suga administration's response to COVID-19 has been criticized as being forestalled, but I believe it was necessary in order to turn the economy around, because no country has succeeded in both responding to COVID-19 and growing its economy. In case you are wondering, Japan's GDP is projected to be negative by about 3% in 2021.